I just hope it will be better this time around. Actually, there was um, an echo in the sound system, so I hope it will be better this time around. Um,
Can you hear me now?
exactly.
Okay, the echo is gone.
Okay, good.
All right.
So the question is, just tell us briefly what this disease is about. I mean, COVID-19.
Okay. COVID-19 is an infection or a disease caused by coronavirus. It is a viral infection. So the virus that is causing it is what is known as coronavirus. And it affects our respiratory system. And that is the gas exchange system of the body, where we take in the oxygen and the carbon dioxide is sent out, you know. And as we all know, breath is life. So if anything is affecting our ability to breathe well, then definitely is going to affect our whole system. How does this thing even get transmitted? The fact remains that it is a new disease to all of us. So we are considering the fact that researchers are still saying that because it's affecting our respiratory system, they are linking it to other respiratory conditions. That okay, if somebody sneezes or coughs, the secretions that come out of their cough or their sneeze, if they are infected, get inhaled by somebody else, that person can be infected. And this is considering the fact that how close are you to the person? Maybe you're like less than 6 feet away, you know? Or like when the person sneezed, there are people, you're outside, you want to sneeze into your hand because you don't have tissue or you don't have an handkerchief. And the next thing is you are seeing your friend and you are shaking your hands. That person, that's a dirty hand. You have secretions there. The next person you have an handshake with, if that person gets to rub his or her face or her mouth or inhale the infection, because the viruses are very small, so we can't even see it with our eyes. And another thing is they're saying it's possible. Okay, I am here. I sneeze into my hand and I'm holding a piece of paper or something and I'm passing it across to you. In a way, that paper is infected, right? And I've
Definitely.
given it to you. You are touching with your own hand. You don't know. You can get the infection through that. You can get it from surfaces. My table, I work, my desk, I sneezed into it. The document on it and all of it. Somebody else's come. Can I use your system? Those are ways we think the infection is being spread or transmitted to other people. So, viral infection most of the time takes about 2 to 14 days to really go through their course. With most people, I'm more infectious around the 2 to the 5th day. Some people can show symptoms as early as day 2. You get see that somebody is infected day 2, they're already showing symptoms. Another person will not show symptoms until like after day 14. And unfortunately, some people will have the infection and they will not show any symptoms. Those are the elderly carriers, but they are spreading it to other people, but they are not affected. So it kind of affects people in different ways, though, you know. So why do who are the people at risk? Everybody's at risk at this point. And like I said, viral infection actually they depend on the host's immunity. If your immunity is low or is not up to par, then you are more prone. And that is why they say people that have other diseases like diabetes, you have asthma, other respiratory infections, make you more vulnerable, not because other elderly people cannot have them, you know, but their immune system are already compromised, if I can use that word, you know. So what are the symptoms that come with this thing? How do we know I have COVID? The unfortunate part is it comes with different symptoms. No two people come with the same thing. Like I know on a regular day when I was back in Nigeria, if I start having cold, like I start sneezing, I start having headache, loss of smell, I know, oh, I'm about having malaria, you know. Now you don't even know what's happening. Somebody will tell you, I have cold, I have cough, I have body aches, and boom, the next thing is it is COVID. Another person will come to you that it is my shoulder blade that is paining me. That is just the only symptoms they have. Some people will run fever. So it's actually, you know, we cannot really say this is it. So it varies from mild to severe symptoms, and it depends on the people that have been affected at this point. It, because it's a viral infection, you can't use antibiotics. So the treatment is symptomatic. If you have headache or you have body aches, they give you things to treat your body aches. The only reason why we are giving people in the hospital, okay, like people that come into the hospital, like they cannot breathe. What are we doing for them? We are giving them oxygen to relieve that breathlessness, that difficulty with breathing. The antiviral we are using is just because scientists say, okay, it could take care of it. But the fact still remains, COVID-19 will run its course because it is a viral infection. So we treat it as it comes. We give you vitamin C, give you vitamin D to boost your immunity, give you zinc, you know. So
Thank you. Thank you for that beautiful information. That will take me to another question that I think my viewers will be very much interested, I mean, to hear of. That is some months back, precisely last year, I think there was a video that went viral on Facebook, on social media. That's I mean, it was done by I mean, the head of AIT News, I mean the owner of AIT News, Aleo Deposi, and he made that video because I think he got infected, and they treated him. And for him, he said it categorically in that video that what COVID-19 are we talking about in Nigeria when we were just being treated with anti-malaria? I'm not seeing anything special. But with what you have analyzed now so far, how do we talk to this type of people that fine they are giving you anti-malaria because you said the treatment is symptomatic based on, so if they are not presenting some of the symptoms of malaria and they are giving them anti-malaria, but we don't know if there are some other things, just like you said, if the person has respiratory problem, distress, they have to please. Maybe he did not have that. Maybe the level of the COVID I had was, I mean, just as you said, there are levels, severe, acute, or whatever, or benign. But in this case now, how do we tell our people in Nigeria, even when they are giving them anti-malaria, they should not think or whatever?
well, the truth about it is researchers are still working on this thing. Like I told you, it is okay. Like when we have cold, and people even go buy pro cold and all of it, it is not that it takes your symptoms away. It only relieves that problem at that point. So even if they give you anti-malaria, like I tell you, viral infection will only thrive in your body if you are immunocompromised. So if in Nigeria they use anti-malaria and the person feels, or the people they have used it for think they are feeling better because of the anti-malaria, are we sure? How do we rule out that they don't have malaria prior to being infected with COVID-19? And because, of course, you feel better, your symptoms will definitely go away. Are you sure when you get infected? Are you sure of at what point did you start the treatment? Are you sure that it's not because the viral course is already almost over and you started feeling better because of what you are using? So we cannot categorically say it is the anti-malaria that made you feel better. It could be treating the underlying condition that made your immune system immunocompromised. And it could be the fact that the viral course is almost at the end of the stuff, and you use it and you got better. So, each man to himself. We can't convince people at this point. Like at a point, you just tell them, do what works for you. As long as you feel better. As long as you don't die on me, just feel better, right? That is it. Just be good. You use anti-malaria, it worked. That be good. It took care of your pain. It took care of your fever. No wahala. It's allowed.
But for them, they'll be like, then COVID-19 is a scam to them. That is the next thing they'll be saying.
My brother, as somebody that is at the front line of COVID-19 and who had been a survivor of the virus or the infection.
We are still going to talk about that.
Seriously, they don't want to say that. They don't want to say that.
Let's come to the next question. And now, as a COVID resource nurse, your heart the certificate. It means that you are well informed. You know it exactly. What are the best way to prevent this propagation?
Bro, see, the truth about it is, as difficult as it is, if you mask up, it makes things easy. I'm not saying it's convenient. Look at me. It's because I've had my bath this morning. There is no time I go to work that we don't have mark strands. It's even difficult for white people because their faces are bruised due to mask use. We are too comfortable. I don't know what exactly to use because we feel like you're my friend, you are not sick now. You are my colleague, you are fine, you are family. No, we have to know that we have to look out for each other. It is not convenient. Must you go out? No. Can you FaceTime? Yes. What you want to go and do outside, can you do it inside? Yes. If you can't mask up, bro, back off. And another difficult thing is the availability of water to wash your hands. Is it available? No. If it is not available, are you going around with your hand sanitizer? Oh, and how many times do we even remember to even sanitize our hand or even wash our hands? That's just the basic truth about this thing. When you want to sneeze, they tell you sneeze into your elbow. It takes away you having to throw things into the wind. If you are so lucky to have handkerchief with you, cover your sneeze with your handkerchief or with your paper towel and throw it away. Social distance. Must you go for Owambe? Must you go for no, seriously, those are the things. See, we have to watch out for each other at this point. People are tired, they're exhausted. And it's not because of all of this thing. And it's simple. Mask up. If you have to sneeze or cough, sneeze into your elbow or sneeze into a towel that you can easily discard, Social distancing. Come on, please, just do this for us. That's all we are asking for. Even with the vaccines, they're saying do these things because you are not even sure yet.
And we are still going to talk about the vaccine. Thank you for that. Now, recently you contracted the virus, and in fact, you were so bold, and then after passing through the disease process, you went back to your Instagram page. You shared the good news that you are back to your feet, even though you contracted the disease and things like that. And there were a lot of prayers for you. Even though my side, I couldn't check it that time, not until later I got to know that wow. So, from your own personal experience now, can you just tell us this disease, as in how deadly it is?
Well, the truth is, like I told you, it affects different people in different ways. So I'm going to tell you that I got lucky. I think I got the mild part of it. But the sincere truth is that the body aches I went through, the pain felt like my bone was going to break. All I could do was just lie down for days. I was scared for me. I was scared for my kids. They are so young, I was like, God, I have a 15-month-old baby at that time. I have a 6-year-old, a 5-year-old. My oldest is just 12. And my babies are like cats. Am I going to tell my children, don't move close to mommy? I couldn't self-isolate in peace. I didn't have any respiratory symptoms per se. Okay, I had to work for 8 straight days because we were short-staffed. People couldn't continue to work. We have to help these people. We couldn't say no to them. These are people that they miss their family. They can't come to see them. So there are times, even in your PPE, you still have to hug them. So if you ask me, how did I get this disease? I don't know, because I made sure that I used my PPE. I washed my hands. I was being careful. And that's what we are still saying, that even in your carefulness, you don't even know where this thing could come from. So when I was done with the day 8 of my shift, okay, I started feeling uncomfortable from day 6. I felt it, that stress, 12 hours of schedule, 12 hours every single day. I felt it was stress from work. So by day 8, day 9 that I was off, I was so tired. I got home, I took paracetamol. I was like, okay, it will get better. I'm not a big eater, so even when I couldn't eat, I felt it was still the stress that was affecting me. I was only off for 3 days, so day 1, day 2, day 3. By the 3rd day, the only thing that actually gave me out was the fact that I vomited. I was very sure I was not pregnant. Number 2, even when I'm pregnant, I am not somebody that vomits. I have nausea, I retch. So I was going to work. Before I left, I vomited. My work was just 2 minutes drive from my house. By the time I got to work, I went straight to the toilet again. I was like, no, definitely something is going wrong somewhere. But I still had to do my work. Then I had to talk to one of my providers that I'm not saying I have COVID, but I'm just not convenient with the way I'm feeling. And there was a mandate already then that as an healthcare provider in North Dakota, even if you tested positive for coronavirus and you are not symptomatic, you continue to work. So I was not even, it wasn't because I wanted to stay off work. So he said, okay, let's get tested. I got tested, and 15 minutes after, boom, I was positive. I was like, how did it happen? I was being careful. The first thing that came to my mind was my children. The hugs, the kisses before you leave home, How do I self-isolate? So sometimes it's not all about us, it's about our loved ones. How do I self-isolate in the house? They told me, okay, fine. They know that at this point you are fine. It's not like, but you have vomited twice and you had body aches. So that means you had symptoms. So you have to go home to self-isolate, For like 7 days, I was in severe pain. I couldn't eat. I didn't have any respiratory. There was nothing wrong with my respiratory system, as in I was that lucky. But from the people I've lost, I can't compare my experience. I can't compare my experience. By day 9, day 10 of my quarantine, I started feeling better though. But after I quarantined my family for 10 days because I was positive, they had to stay home for extra 14 days for them to be sure that they are not infected. But know that in between these 14 days, my 6-year-old vomited. He had sore throat. All my children, my other children, they had cough. My husband had sore throat. But they couldn't get tested because that's the rule. If they get tested and any of them get positive, then I have to join them in the quarantine again. Then what happened to the workforce? Was I scared? Yes. I was thinking, It was scary. But I have to go back. These people need me. I could remember a patient I nursed. She was in her 40s, but she has the mental ability of an 8-year-old. All she could scream for was her mom every day, every night. There are times you had to sit down and hug her. I had to tell her, okay, mommy is not here now. Mommy will be here tomorrow. And that is what all of them had to go through. Even for people that are in their mental capability of their age. Just imagine somebody being on the highest dose of oxygen that you could give, and they still can't breathe. Their saturation is still down there and it's still sinking. So I can't actually compare my experience. Well, I use zinc, I use vitamin C, I use paracetamol for my body aches, and we used black seed oil, ginger. Well, no, astagfirullah. We used lemon water, warm lemon water. We used honey, and well, I know Larigba, we cannot say we had, well, but we survived it, sha. We tested positive and we survived it, right?
Yeah,
So,
yeah. I think it's quite I don't know how to say it. It's you are such an hero. Let me just use that word. Permit me to
like,
use it because at least despite the fact that you are down, you still go to work. Can you imagine that? Because and the workforce is not is like
he's stretched
unprecedented
out.
level exactly. So
He's stretched out.
I think that is one of the that is one of the things that I actually analyzed during the initial when the wave was so strong about the COVID and the spread out. That is not about, even if we are talking about our loved ones and things like that. Is the health system. The health system is overstretched, and if the healthcare workers are now being infected, who will now take care of all
We are
those
not even
people?
being tested. Do you understand? Even because I had symptoms, I will still be made to work. They're trying not to test health workers.
Okay.
They're trying to make sure that you don't get tested. And even if you get tested and you are positive and there is no symptoms, you go back to the workforce.
I think that is another topic, another thing we are going to talk about because this is